Are you looking to expand your aesthetic practice and attract high-quality new patients? Discover the power of digital marketing in growing your practice with a personalized strategy session. Join Ryan Davies, Equa's marketing director, for an exclusive 90-minute meeting. Ryan and his team will invest hours prior to your session crafting a customized marketing plan tailored specifically for your practice. This invaluable opportunity comes at no cost to you, with no commitments attached. Schedule your meeting with Ryan today by visiting www.businessofesthetics.org/MSM and take the first step towards transforming your practice with the potential of digital marketing.
You're invited to join our exclusive monthly webinar brought to you by the Business of Aesthetics community. Don't let this chance slip through your fingers. Secure your spot now for a game-changing experience. Explore the details on our homepage at www.businessofesthetics.org and get set to transform your strategies.
You are listening to another episode of the Business of Aesthetic podcast series brought to you by our gold sponsor, Equa Marketing. If you would like to network and share your experience with our podcast guests and other aesthetic industry professionals, join our Facebook or LinkedIn communities by searching for Business of Aesthetics. Prepare to be inspired as we introduce Ryan Davies, an esteemed professional and seasoned digital marketing advisor at Equa.com, renowned for his expertise in sales and marketing psychology. Ryan possesses a wealth of experience collaborating with companies and political campaigns. He profoundly understands the intricacies of consumer behavior and how it influences purchasing decisions. As a certified Sandler sales and challenger expert, he brings a unique perspective, employing innovative sales techniques that drive tangible results. Without further ado, let's dive in.
Welcome everyone to another captivating installment of the Business of Aesthetics podcast. I'm Ryan Davies, your co-host at the heart of the Business of Aesthetics community and podcast show. Before we immerse ourselves in the riches of today's episode, I want to extend my profound gratitude to all of you, our incredible listeners from across the United States and across all corners of the globe. It's your willingness to embrace and share this podcast and your invaluable insights and experience that have collectively transformed our community into a thriving epicenter of wisdom and innovation. It's your unwavering dedication that's the cornerstone of our success, and we can't thank you enough. And with that, it's reasons like that we're able to bring you such esteemed and incredible guests and cover our today's main topic, elevating patient experience, strategies for growth and patient satisfaction, with an incredible guest, Dr. Heather Rogers, dermatologic surgeon and co-founder of Modern Dermatology. Dr. Rogers, thank you so much for joining us here today.
Happy to be here. Thank you for having me.
Excellent. A little bit about Dr. Rogers for our audience. She is a board-certified dermatologist, a Mohs micrographic surgeon, holds a significant role in the field of dermatology. As mentioned, she is the co-owner of Modern Dermatology, and she serves as the CEO of Dr. Rogers Restore Skincare, while also contributing as clinical faculty at the University of Washington, previously educated at prestigious Stanford University and the Washington School of Medicine before completing her dermatology residency at Columbia University, where she held position of chief resident. And it's, I believe, 2015 is when you started Modern Dermatology in Seattle, delivering exceptional physician-led dermatological care. And I guess, you know what I'd love to do is people probably don't want to hear it from me. They'd love to get the background from you. So Dr. Rogers, color us up a little bit more. Tell us a bit about your journey and where you're at so far.
Thank you for the kind introduction. So you're exactly right. Dr. James Collier and I opened Modern Dermatology in 2015. I did my dermatologic training, both my residency as well as a fellowship in Mohs surgery, as well as a fellowship in aesthetics in Manhattan. And, it's a really, really crowded space there. There's a dermatology office every 10 blocks. And I was very impressed with the boutique experience that people could have in New York, where it really was a white glove, hands-on doorman experience. And when I moved back to Seattle, that really isn't the paradigm here. It's usually one, maybe two board certified dermatologists, and then multiple physician assistants, physician extenders, and there felt to be more of a focus on quantity over like the quality of each individual experience. And I felt like there was space for that white glove experience. So I convinced Dr. Collier that he would want to do this with me, and we opened Modern Dermatology. And in Modern Dermatology, you know, we have a mission statement in our lobby about how it really is our reason for being to provide the best possible care to our patients, but also create a supportive, wonderful place to work for our staff. And I feel like that is incredibly closely tied together. And if you don't value your staff is not going to value you or your mission or the care you want to give your patients. And so it really sort of has to start from you, the leaders, but also really every step of the way. And if you are unwilling to do that work, I think it's really hard to grow in a meaningful way. Like you can always advertise, like advertising is a great way to get your name out there, but the most powerful way to advertise is word of mouth, right? Is truly to have patients have such wonderful experiences that they want to brag about their doctor's office. And that's really been our focus, is to use each interaction as an opportunity to really show what we're capable of.
And you mentioned in there, a few things, obviously, but, it starts from the top down to create that superior patient experience. You've got to make sure you've got the team aligned. What else would you say, key elements for you that are contributing to that word of mouth, to those people that want to shout it from the rooftops, that Modern Dermatology is the place there? I got this done, and this is where you need to go as well. And everybody loves that.
We've been doing this long enough where we have close to 1,000 5-star reviews on Google, right? So we do we do a good enough job that people choose to review us and say nice things about us. There's so many different ways you can do this, but I think it's really important not to nickel and dime your patients. And if you want to provide aesthetic services, charge enough where everything's included, right? Where it's not a markup for this or a markup for that, because there's two different things here. There's the medical care, which is insurance-based, and I think people are less discerning. They're like, you're a doctor, you have an appointment, I'm going to see you. And then there's the aesthetic side of things, which is truly an incredibly competitive marketplace. And lots of people go one place for the aesthetics, another place for their medical. And that needs to be a spa-like experience, whether or not you are a medical spa, right? Like we are not a medi spa. We are very much a medical practice. But you do want to make sure that if you are lasering someone, that they get a wonderful post-procedure kit and instructions. While they're waiting, they have nice magazines, they have good numbing. Like I have a number of patients who come in and they're like, I've never had numbing for filler before. And, it's more expensive to put numbing on the person's face and let them sit for a half an hour and occupy space in your office. But their experience is so much better with that. And I think that people are short-sighted to say, oh, I'm going to cut these corners because then I can see 2 more patients that day. And then realize that, those 2 more patients might feel rushed or not cared for, and actually will have a negative story to tell.
And for new patients, for people either who have just discovered you, again, got that word of mouth, or whether it's somebody who, is in for that first consultation, how are you able to prioritize that and put on display that patient experience is so important to you, so it stands out to them and they feel comfortable? Because that's a huge thing, right? Especially in healthcare, there's two, the trust element. Like you said, you've got 1,000 5-star reviews. I think that's going to be part of it, is people see that and go, okay, already I've got a lot of trust inherent into coming here. But what other steps do you take to make sure it stands out through that, either before you've even met them, so of displaying on social media, website, etc., or especially when they're in that consultation with you, to say, hey, this is something we really prioritize and here's the proof behind that?
So I think the experience begins with your front desk. And if your front desk is not warm and welcoming, people come in, particularly new patients, nervous, right? They're interested in a procedure that they're embarrassed to tell their friends that they're interested in. They might have to get naked for a skin exam. Like it's a stressful, and I think when you don't know what you're walking into as a patient, you get your feathers ruffled really easily. So I cannot be more positive about my front desk. They welcome with a smile, they have name tags, they really do try to have the person feel comfortable and well cared for while respecting their privacy. You aren't, oh, you're here for your Botox appointment, right? Like it's a polite, respectful interaction. We try incredibly hard to run on time. You can't always do that, but our rule is if you're more than 10 minutes behind, you notify the front desk. So the front desk can then tell the patient, Dr. Rogers is running 10 minutes behind. Would you like a cup of coffee? Like just something to have that person feel really taken care of before they get into the exam room. Once they're in the exam room, um, it gets a lot easier, right? Like then they're safe. Then they're in a private situation. We have staff that bring them back. Half of our staff are RNs. The other half are medical assistants. They bring them back and they really sort of allow the patient to talk about what they're interested in, what brought them in. They then present that to the doctor, who then goes in and talks to the patient again. And we really try to prepare people that that first visit isn't about getting something done, right? If they want to get Botox or a neuromodulator on their first visit, we usually can do that for them. But it's really about educating them about modern dermatology, about the services we offer. And in particular, I do a lot of the really big, complicated cosmetics. I do the Ellacor, I do the aggressive CO2 lasering. And so really it's about showing them what we're capable of, like from the
Right.
easiest procedures to the most complicated procedures, and figuring out where they are. Like, is there a wedding in 9 months and I got to do everything I can to make them look beautiful? Or are they cosmetic curious and they just sort of want to know what's out there? So it's really important to sort of figure out what their needs are and the reason for that visit. And then we have a lot of education. So I will then talk to them about the different services, what I think would be good for them. And each one of those services has an education sheet. Everything has a price associated with it. So they leave with anywhere between 2 and 7 education sheets, a menu with all of the costs, and there's no pressure. There's no like, oh, sign up now, you save 10%. Like none of that.
Mhm.
It's just, here is the information that is available to you. Think about it and, call if there's something that you would like to do. I would say even with that, 80% are scheduling on their way out just because they're excited and they want to have something happen. But I I don't want people to feel pressure. I mean, they shouldn't do a cosmetic procedure unless they're more excited about it than scared, right?
Right.
And there's a lot of patients who I've seen who are like, "Oh, I felt like I had to do it. I felt like they really wanted me to do it." And I was like, "Well, yes, this is a cash pay thing. Of course, people are going to feel that way, but." But really, your provider should help you, the patient, reach your goals, and the goals should be aligned.
I think that's just incredible, and it's just again showcasing I that expertise and experience and authority, like you said, the education behind it, the combined years of experience, all of those things. Like I said, when I did your intro, I was reading the list of education that you had, and I was smiling and laughing through it, going, "Boy, this is like a who's who checklist of where you want to go." So being able to showcase all of that, so incredibly important, and does so much to help again the confidence and set up that patient experience for what they can expect. But even I know this is something you wanted to speak on as well, and I think this is such a great topic. Is it doesn't matter how amazing everything goes in this field, there are always going to be some instances of complications, and it is an incredibly challenging aspect of operating, owning, being a practitioner in any practice like this. How do you and how does modern dermatology approach the management of complications?
So this is my number one teaching point for people who want to do aesthetics is you, be careful. Be careful if you want to enter into the arena, because if you are in the arena, you have to deal with whatever comes into the arena with you. And a lot of people are like, oh, it's easy. Filler is easy. Nothing can go wrong with Botox. And that is horribly untrue. And it's, I love doing cosmetic procedures and I do them all day, every day, but you cannot do something that often without complications, and you have to be prepared for those complications. And, I would say some of my most favorite patients, and my patients who appreciate the most, are the patients I've held their hand through a complication that I've caused. And so this is a big important topic for me. So first of all, like, do not do a procedure where you cannot deal with the complications. I think that's the most important thing. So if you don't know how to deal with a hematoma, don't do surgery, right? If you don't know how to reverse filler, don't put filler in. And even as a very well trained cosmetic dermatologist who's a Mohs surgeon who does big surgeries on a daily basis, I don't feel comfortable doing retrobulbar injections of hyaluronic acid. God forbid I were to create blindness from injecting filler. But I have a plan in place. I have the oculoplastic residence pager number on call. I have a cheat sheet. Like, it's one of these things where you need to think of the worst case scenario and have that plan set up in your office. And then you have to review it every single year with your team, because when people are stressed out, they don't think as clearly. So we do every other month, we close the office and we do an hour and a half to 4 hour education with the whole staff, front and back office. And once a year, we review all the emergencies, and it's, filler emergencies, if there's a fire, excuse me. All these things, because people need to be reminded, because common sense goes out the window. So first and foremost, if you're going to do a procedure, you need to be aware of all the complications. You need to deal with the complications. The first 100 times you do a procedure, you might not see a complication. And that doesn't mean because you're amazing. It's because you've only done 100. Wait until you've done 1,000 of that. And once you've done 1,000 of that, you will have seen a lot. And I think one of the problems with bringing in new technology is that it takes a long time to get really, really good at the new technology. And we're all excited to try the new hot thing. I'm using Elocore right now. Like, we all are into these new things, but you don't truly know what's behind the corner until you've been doing it for a while.
Yeah.
So some of my favorite technologies, I've been, like the CO2 laser, I've been doing it for 15 years. And I'm really, really savvy with its settings, but also I've caused scarring with the CO2 laser. There's been staph infections with the CO2 laser, and patients are really forgiving of those things if you talk about it ahead of time. Like, listen, if I do strong settings, there is a chance your skin's going to heal really slowly. If you have a history of staph infections, you could get a staph infection and we should put you on antibiotics. But I think doctors do themselves a disservice by not going through all the things that could go wrong from the beginning, because it shows an inadequate understanding of the procedure, and it gives the patient unrealistic expectations. So even though it takes longer and even though it might scare patients, it is so much better to not be flamboyant about it, but to really go through, okay, these are the things that could go wrong. This is what I will do, God forbid if that happens, to see you through it. And then when things do go wrong, I think pride, embarrassment makes it so providers disappear. They don't want to know, they don't want to follow up, they get nervous. And that's the exact opposite. If you don't hold your patient's hand through a complication, you're going to lose that patient. That patient might tell 400 people about how awful you are, and they might sue you. So it's just so much better to take responsibility for your role in it, even if it's a small part of it, and hold the person's hand. And what that means is you check in with them every week until it's gone, right? And they might get a number of free treatments until the problem is gone. And that is good medicine. That's the what you take on by charging them a lot of money for the cosmetic procedure in the first place. And sort of a teaching point for me that someone told me when I was learning Botox was when Botox first came out, the dilution was a lot more and the Botox would migrate a lot more. And the plastic surgeon injected a woman's forehead and dropped both of her eyelids, so she really couldn't see very well. And he called her and was like, I am so sorry, this will go away, but what's the worst part of this for you? And she's like, I can't drive, like I don't feel safe driving. He paid for her to have a chauffeur for a month, right? And like that is an example of what you should be willing to do, right? And that's expensive, which means you need to charge enough to deal with your own complications, right? So if you're going to CO2 laser someone, CO2 lasers have complications. Don't charge $1,000 for that procedure. Charge $1,800 for the procedure. And that way you can hold their hand through it. You can, like, I call all of my CO2 patients the day after. I see them a week after. They all get a full set of post-procedure care. Because I want them to have the best possible experience and the best possible outcome. And that's only possible if you really control it from the very beginning to the very end.
I think that's incredible from that perspective to talk about, again, a great lead into the importance of aftercare, good or bad, right? It's absolutely crucial in this industry to make sure that you're doing it the right way. And you've already kind of touched on it, but I know this is a focal point as well in the overall patient experience with modern dermatology. How do you ensure that patients receive that adequate aftercare and support and guidance following procedures to make sure that they've had that holistic experience, again, from the lead-in, the consultation, the actual procedure, and to ensure that you really close that loop and create them coming back again?
So, again, this is a fascinating thing for me where I think a lot of physicians think what matters is what happens in the room, right? So like what in the room where it happens. So like what matters is, does the doctor do a good job with the procedure, right? That's what we focus on. But in fact, that's really only part of the story. And to get consistent, outstanding results, there's sort of three parts. One is you got to pick the right patient, right? Like I've been talking about CO2 a lot on this. I'm going to continue that analogy. If somebody has really dark skin, aggressive CO2 lasering is not the right choice, right? If somebody has, a rosacea and you aggressively CO2 laser them, their redness is going to get worse. So you have to choose the right person for the treatment. Then you, the doctor, have to do a really good Baced treatment. You have to know your settings. You have to do that treatment correctly. Then the patient has to leave with enough information that they can't mess it up at home. And it's amazing to me how uncommon that is. The effort to make the post-procedure care very clear for the patient. And that's two things. One, it's instructions, and two, it's actual products that are safe to use during the healing process. And a number of really capable, wonderful doctors out there really don't know much about skincare in regards. They're like, oh yeah, just use Aquaphor, it's fine. Like it's like whatever they learned in their residency, that's what they recommend. And like patients want, like if they've just spent thousands of dollars on having their face lasered, patients want to know what to do every step of the day. They want to know what to do when they get up. They want to know what they have to do if they're going to go outside. They want to know what to do when they are going to bed. And so for any patient who I touch, they get what to expect ahead of time emailed to them, and then they get how to take care of it when they walk out. And if it's a laser procedure, they get a post-procedure kit, and the kit is anywhere from very small to very large, depending on what the recovery is. And this is, a segue into my skincare line. The reason why I made Dr. Rogers Skincare was because I was sick of seeing allergic reactions to what people were told to use. And so often what we were told to use after a procedure is petroleum-based. It has lanolin in it. Lanolin was the allergen of the year last year. And early in my training, I saw two really, really bad allergies to Aquaphor. And I swore it off. I was like, I will never use this again. I cannot recommend something that could lead to this complication. And so I made a ointment, a healing balm that is made out of castor oil, castor wax, and glycerin. It did a split phase trial against Aquaphor. The skin healed significantly faster. It had 90% preference in patients. And that was sort of the beginning of this whole other world that I live in, which is actually very similar to modern dermatology, where I make superior products that do exactly what they're supposed to do, just like I provide a superior product as a doctor that does, for the most part, what it's supposed to do. Like it is very important to me to under promise and over deliver in both aspects of my doctoring world. And I don't need people to use my post-procedure kits. Like I launched a post-procedure kit with a well-known beauty company called Violet Grey. But I need you as the doctor to have something that your patients can count on. And whatever it is that you, the doctor or the laser specialist is using, you want to know what those products are, and you want to have tried them on yourself, and you want to make sure that your instructions to the patient make sense. And that also, well, I'm ranting here, is it's amazing to me how many providers do procedures on patients and they've never experienced the procedure. Like, how can you tell someone what it's going to be like, what the recovery is going to be, if you've never experienced it? And yeah, there's things that I do for people that I don't need, right? That aren't like, isn't my problem with my skin. I still have the procedure done because I need to know what it's like. I allocord myself. It was insane. But like fundamentally, you have to know what this is to do a good job seeing someone through it. And so it's absurd that you're going to be able to explain and hold someone's hand through something when you haven't experienced it and you aren't telling them how to heal and what the healing is going to be like. And that is actually the longest part of the process for the patient, right? They're in your office for an hour, but then they're dealing with the repercussions of that procedure for days to weeks. You have to prepare them. Like, it's absurd.
That's a great call out, because I think that's honestly, I'm surprised I haven't heard that more from conversations, right? But that's exactly it. It's very difficult to give firsthand knowledge or to build that trust when it's like, oh, so you've had it done? No, but I've heard, people have told me, and it's like, yeah, well, that's what Google's good for. I want to know from you, if I trust you, what you've got to say
Yeah.
about it, right?
Have you had this?
As
Why
we wrap
haven't
up,
you had
yeah,
it? Yeah. Have you had it? Why
yeah,
haven't
right.
you had it?
Why
Like,
are you avoiding it? Yeah.
yeah, exactly, because that is a legitimate concern, and you are a better provider when you've had to go through it. Like my daughter bashed my nose in, and I got two black eyes, and I had to get a bunch of stitches on my nose, and like that was a good thing for me to go through because I stitch people's faces up every day, and I was like, okay, like I it's that awareness makes you a more empathetic doctor.
If your daughter is going to listen to this, is she going to be like, "See, I did you a favor," or
Yeah.
like, is that going
Yeah, no,
to?
she already knows. She already claims that. Don't worry. She's 13.
There you
She
go.
there's lots of wonderful sassiness there, right?
I've got a few years until I get there with my two girls, and I can see it starting to creep into play here. So, good to know. Again, see, you've had an experience, so I'm prepared for what's to come. This is great. Um,
Exactly.
as we wrap up here, I would love to kind of get sort of a bit of a final piece of advice for you, something lasting here. Again, we've talked a lot about elevating the patient experience. We've talked a lot about, putting your expertise on display. Again, doing it personally for yourself, not hiding from complications. For anybody, whether they're looking to get into this space or for, even just, again, seasoned, experienced dermatologists and aesthetics providers, any advice you'd have for them based on, again, the patient experience and how you can really get the most out of it?
Um, I do, depending on people's practices. I think that you as a group have to support everyone in your practice. So, if there's a complication in my practice, it doesn't matter if it was me or one of my other four providers. I am oftentimes the person who gets brought in to deal with it, and I like to do that. We don't charge for complications or follow-ups. Like if somebody needs to send us photos, if somebody needs to come back in, that is something that we do free of charge. One of the pet peeves of mine is people get filler and then they don't like it and they want their filler reversed, and the office charges them for reversing the filler. And the stuff to reverse filler is expensive, but that's the fastest way, again, to lose people, to do a treatment on them and not see them through it. Of course, you should always have the hyaluronidase, but if you're taking care of your own, there shouldn't be an additional cost associated with that. And then in addition to sort of supporting the other providers, the whole office needs to be able to support the providers. If somebody's calling with a question or a concern, don't be dismissive of it, particularly in regards with filler. A bruise can show up the next day, but an occluded blood vessel can show up the next day. So your staff really needs to be able to err on the side of caution in those things. It's better to have them send in a picture, tell the back office staff quickly, than to be like, oh, it's just a bruise, don't worry about it, and then actually have it be a rare complication. And it's just, if the team knows that the owner, the leaders, has everyone's back, then they're going to have your back, and it's so much better when your team has your back. Like everything's better.
Yeah, absolutely. I love, again, like you said, top down, make sure you're setting expectations both internally and externally, right? For your staff, expectations, how to handle situations. I mean, there was so much great things to unpack there. Take the time to run through the contingency plans, and just everybody's educated so they're not surprised. And then same thing for your patients that are coming in. They're not surprised if something happens. That might not be ideal that there's a complication, but at least they feel comfortable, like, okay, Dr. Rogers mentioned this could happen, and now there's going to be a process in place. And I feel confident that in the end, everything is going to be just fine and work out, and I'll be in that place that I was hoping to get to, and things to that effect. So, Dr. Rogers, thank you so much for joining us here today. Before we sign off and close off here, where can our listeners learn more about Modern Dermatology, your skincare line, and stay updated on your work?
So I have a pretty active social media presence, and my handle on Instagram is Dr. Heather Rogers. And that's sort of the easiest way to keep track of what's going on. My website for Modern Dermatology is MD in Seattle. So Modern Derm, mdinseattle.com. We're around, I'm available, and I'm pretty easy to get a hold of, particularly through DMing.
Incredible. Well, Dr. Heather Rogers, thank you so much for joining us today, taking us through your journey, and giving us a ton of insight into the patient experience and how to really elevate that and ensure, both personal growth, your business growth, and for your patients that they get the growth they're looking for as well. Really appreciate it. Thank you so much today.
All right. Thank you.
Excellent. I also want to take a moment to thank our listeners. We appreciate each and every one of you. We cannot do what we do without you. So if you like our podcast, please kindly share it on social media. Tell your friends, your family, and your colleagues about it. And don't forget to leave a review wherever you're listening, iTunes, Google Play, or elsewhere. It's your thoughts that will help other doctors and practice owners find us and bring incredible guests like Dr. Heather Rogers to you. So thank you all again. And until we meet again, I wish you all an amazing week ahead. Thanks, and take care.
Thank you for joining us this week on the Business of Aesthetic podcast series, brought to you by our gold sponsors, Equa Marketing. Would you like to join our growing group of aesthetic industry experts and get featured on the Business of Aesthetics podcast? Or do you know someone who would love to share their strategies for growth in the aesthetic business, providing quality patient care or their clinical expertise? Head over to www.businessofesthetics.org/podcast show and apply to be featured as a guest on the show. Remember to subscribe to this podcast on iTunes, Google Play, Amazon Music, or wherever you listen. If you would like to engage with today's speakers or any of our past speakers, join our Facebook group or LinkedIn group by searching for Business of Aesthetics. Thank you and have a great day.